It's only love and that is all. Why should I feel?
Hi all my wonderful TM joiners. I'm Priya Mistry, the TMJ doc, and in this video, I'm going to be explaining the difference between two common jaw conditions. In layman's terms, these conditions are called locked jaw and jaw locked closed. So they sound very similar in layman's terms, but they're quite different as to what's happening in terms of anatomy, how they should be diagnosed, how they should be treated, etc. In medical terminology, locked jaw is called trismus, and jaw locked closed is called disc displacement without reduction. What's tricky is they sound similar in layman's terms, and they present similarly in the sense that they both lead to a severely restricted range of motion where you can barely open your mouth more than 1 or 2 finger widths, and they often come along with a lot of pain. Watch this video until the end for all the information about the difference between these two conditions. Be sure to check out my other social media accounts. I'm pretty active on Instagram, on TikTok, kind of on Twitter, not so much, as well as my office website for more information on TMD or if you're looking to seek treatment with me. A quick update, I'm now selling these TMJ face rollers. They help quite a bit with jaw pain as well as with headaches if you're using them 3 or 4 times a day. They're also nice and cool to the touch. So for me, that feels really therapeutic. You can always wrap them in a warm towel if you prefer them warm. So I do sell them on my office shop. So check out my office website, which I've linked below. For those of you who don't know me, I'm a general dentist with a practice in Vancouver, Washington. In my practice, we are dedicated to taking care of those with TMJ disorders. Please take a moment to hit the little subscribe button so that these videos can be found more easily by those who are suffering from TMD. So let's get right into it. Let's start with the terminology. Like I mentioned before, locked jaw and jaw locked closed sound very similar. And again, these are the layman's way to refer to two different conditions. One more time, locked jaw is trismus and jaw locked closed is disc displacement without reduction. Let's examine both of these more closely. Let's start with lockjaw or trismus. I'll be referring to this condition as lockjaw for the rest of the video. What is lockjaw exactly? Lockjaw is where you can barely open your mouth due to sustained spasms in the jaw muscles. So the muscles keep spasming and get into this dysfunctional state where you can barely open your mouth. What causes this to happen? Sounds pretty horrible, right? Well, my friends, it can occur due to head and neck cancer treatment as a side effect to certain drugs. It can be due to infection. It can happen after a dental extraction or due to local anesthetic being unintentionally injected into a certain muscle during a dental procedure. This muscle is typically the medial pterygoid muscle. Lockjaw can also occur due to being hit in the head or just any general trauma to the jaw or the head. Everything I just listed can lead to painful spasms of the jaw muscles. This will then lead to a restricted range of motion. Basically, you can barely open your mouth and it's super painful. Not fun. When the jaw muscles go into sustained spasms, this is a reflex. It's a reaction to muscle damage, and it cannot be controlled by the individual experiencing it. So that's an important thing to remember. This condition typically needs some treatment. When the muscles are in a state of sustained spasm, the jaw cannot function normally and leads to a very restricted opening. Usually 1, maybe 2 finger widths if you're lucky. It's usually 1 with lockjaw. If you're wondering how lockjaw is treated, please watch my YouTube video called What is Trismus? I've linked it above and below, and find a local provider in your area that can help you through this condition. Let's move on to jaw locked closed, also called disc displacement without reduction. So I'll be referring to it as jaw locked closed for the rest of the video. With jaw locked closed, what causes the restricted range of motion and the pain is actually a little disc of cartilage called the articular disc becoming dislocated. When the disc is dislocated, it's usually too far forward and in towards the center of the head. And it actually serves as a barrier to opening when it's dislocated. So that's what leads to the restricted range of motion. When that disc is dislocated, the muscles of the head, neck, and jaw go into spasm, and that can lead to a lot of pain. Headaches, neck pain, jaw pain, ear pain, lots of different things come along with this. You can also find those same symptoms with lockjaw, so that's where it gets a little bit tricky. So how does disc displacement without reduction even happen? It can happen due to chronic clenching, chronic grinding of the teeth. It can be because of an imbalanced bite or because of whiplash or any direct injury to the head, neck, or jaw. Which do I see more often between lockjaw and jaw locked closed? I see jaw locked closed much more often than I see lockjaw. Typically with jaw locked closed, there is a history of clicking and popping leading up to the incident where the disc becomes dislocated, leading up to the locking incident. With lockjaw, there is not typically a history of clicking or popping leading up to the incident of injury. So again, this is something to keep in mind to differentiate between the two different conditions, lockjaw versus jaw locked closed. I treat jaw locked closed disc displacement without reduction with an over 90% success rate at my office. Many people, including practitioners out there, believe that the disc, once it's dislocated or displaced, that it cannot be recaptured unless it's surgically recaptured. And I'm here to tell you that that's just not true. My mentor, Dr. Arthur Parker, did TMD work in this area in the Pacific Northwest for the past 30 plus years. And he has thousands of success cases with disc displacement without reduction, where we were able to recapture the disc, restore a good range of motion, and eliminate pain. For more information on how I treat this condition, please watch my video, How I Treat the Locked Jaw, Jaw Locked Closed. I've linked it above and below. So let's recap. What is lockjaw or trismus? Lockjaw is a sustained spasm of the jaw muscles that leads to a severely restricted range of motion and pain. Jaw locked closed or disc displacement without reduction is when the little disc of cartilage is dislocated or displaced in the jaw joint. It's too far forward and in. That leads to a severely restricted range of motion and pain as well. Again, these are two very different conditions which can appear the same on the outside and have very similar non-technical sounding names. For successful treatment, lockjaw must be treated differently from jaw locked closed. And again, I see jaw locked closed much more frequently at my office than I see lockjaw. So that's really it, my friends. Again, I'm Dr. Priya Mistry, and I hope you found this information helpful or useful in some way. If so, please feel free to like, subscribe, and share with your family and friends. For those of you who are looking for TMJ pain relief from the comfort of your own home, please feel free to download my free PDF guide called 3 Steps to TMJD Pain Relief. This is available on my office website, so please check out the description box below for the link. Questions and comments are always welcome. I look forward to hearing from you. And again, my friends, you can never have TMI about TMJ. Thank you.
Why should I feel the way I do? It's only love.